There are 700,000 babies born in England every year. Fantastic. But when it comes to delivering them, we're 2,300 midwives short, according to an official report. So how come we love watching deliveries on telly, but we can't deliver midwives? And there's confusion in government over who is ultimately responsible for delivering them, as our health and social care correspondent Victoria MacDonald reports.
Baby J, maybe Joseph, perhaps James, it's yet to be decided. Born Wednesday, £6 13 ounces at University Hospital, Coventry. Mum very happy.
Baby J. It's been really good. It's a really positive experience. The aftercare here has been brilliant.
And that's what the hospital is looking for, because it's recorded now. The friends and family test, as in, would you recommend this unit to your nearest and dearest? And the mothers are asked this question at each stage, before, during and after the birth. What is it that you want from a maternity unit?
Just support really on from the staff and reassurance, throughout the process.
The friends and family results were published this week, and Coventry was singled out for having reacted with remarkable speed to the wishes of the mothers here.
We've opened our visiting from 9:30 in the morning to 9:30 at night for dads. We're looking to put extra beds in our single room so that partners can stay overnight. So they're the things that, and we've also started the parent education sessions for women so that they get extra support and know what they're doing with their babies.
And these are all the things that the mothers said to you, this is what we want?
All of the things that the mothers said.
This is, of course, what it's all about, the safe delivery of a healthy baby. But increasingly, across England, maternity units are under pressure. There's a rising birth rate, there isn't enough money in the system, and there are too few consultants and midwives. Indeed, a Public Accounts Committee report today says there is a truly worrying shortage of 2,300 midwives. But when the Department of Health and NHS England were asked who was responsible for ensuring there are enough midwives, they didn't have an answer.
What was extraordinary was that when I said, who is responsible for ensuring we get 2,300 extra midwives? Who's responsible for ensuring there are enough consultants? Who's going to tackle the fact that midwives are feeling so under stress that a third of the midwives who've been practicing for less than 10 years are thinking of giving up the job? There was a stony silence. And neither the Department of Health nor NHS England was willing to put their hands up and say, it's my job to sort that out.
The committee also says the most up-to-date figures show that a quarter of maternity units had to close for half a day or more because they couldn't cope. And they were critical of the experiences of black and minority ethnic mothers, especially in choice and continuity of care.
It's incredibly important that we get more midwives out there into maternity services if we're going to ensure the highest quality of care.
The Department of Health says there are now 1,500 more midwives in the system and 5,000 in training. But you only need to look at Coventry to see that the pressure is growing. More than 6,000 babies are born at this hospital every year.